Here today with Komal Bajaj from New York Health and Hospitals, and you just wrapped up a presentation here at the HITLAB Innovation Summit, basically explaining to everyone how you're rallying the troops.
That's right, Jim.
So tell me a little bit about that.
Yeah, absolutely. Well, first of all, the vibe here at HITLAB is just phenomenal. And it's great to be, with so many different people interested in technology from different perspectives. As we think about digital technology, at the end of the day, it's already starting to transform care and will continue to transform care. And thinking about how we engage the healthcare workforce in that transformation, in the implementation of solutions, from my perspective as a chief quality officer and as a physician, is crucially important. Because at the end of the day, we want to get technology out to people quickly, and we want to really make that impact that we're all hopeful to see.
Right.
And so, some of the things that I think are givens, right, that are non-negotiables when it comes to implementation have actually been discussed, throughout the days here. Things like co-production, right? The ability for staff and patients to weigh in on the design of a product. That's a given, right? Whatever level of training is required, addressing cybersecurity, all of those plans must be in place before implementation. But I think there's a real opportunity here to think a little bit differently about how we engage the workforce. And some of those solutions come from making existing work for us. So for example, there's a lot in healthcare that needs to be fixed, but there's a lot of awe-inspiring things that happen. And so we've taken the approach of really unpacking success by looking at the root causes for success. How does that translate to digital technology? Well, if an implementation happens somewhere, right, really understanding very granularly what were the moves that were made, how was the healthcare workforce engaged, will help really accelerate the implementation to somewhere else. And so oftentimes people will be like, yeah, we trained them and we did, and we co-designed, but really getting to the very specifics. We did it at this interval, at this timing, and that's what we saw crystallize the experience. That's really sort of what I'm looking for. Some of the other things that I've been really thinking about is, there was a Commonwealth Fund survey that surveyed healthcare workers about their preferences related to addressing waste in healthcare as a means of promoting planetary health. And what was really surprising, Jim, is 80% of the healthcare workforce wants to work on addressing climate change. I mean, there's not much that 80% of the healthcare staff will sort of agree upon. And
80% of anyone
That's
anymore.
right.
Yeah.
That's right. And so what we're seeing is that people are almost coming for the climate action, staying for the improvements. And so as, digital solutions are being put into place, really thinking about, well, how does this reduce waste, right? What do I no longer have to do, right? And being able to sort of speak to that can be very engaging for the workforce.
The buy-in is interesting to me, though, because I would think there are two groups. There are the people who have done something the same way that they've always done it and like it and don't want to do it any different anymore. And then there's probably a younger group that's a little more adaptable to the change and receptive to it. So I guess how do you get everybody together?
Yeah, well, I think something that was very liberating for me early on as a chief quality officer was, from the beginning, you don't have to have everyone on board, right? You're really looking for those early adopters, the early majority, the people who are at least willing to give it a try. And oftentimes, through their experience, they end up being your loudest spokespeople. And so I think as people are thinking about implementing digital solutions, right, start small, right? Maybe a subset of the population or a small set of diagnoses, right? Once you sort of tinker, figure it out, get that engagement, get those early people on board, it will oftentimes be a lot easier to, like you said, get those people who are not really interested in changing. Because there's a certain level of FOMO that happens, once you reach a tipping point.
Right. So does it also follow that the smaller the healthcare system, the more nimble and acceptable of change it is, as opposed to the larger, more deliberately moving healthcare system?
Yeah, that's an interesting question, Jim. My experience has always been in very large health systems who have some level of willingness and motivation, right? Aligned with their mission, right?
Right?
Technology then is aligned with the mission.
Right?
But I mean, it makes logical sense that smaller organizations, just like if you sort of think about startups and large pharma companies, right? Startups can move very, very quickly, whereas larger companies may not be able to move as nimbly. So it makes sense to me that smaller organizations might be more willing to tinker and pilot because they have sort of more visibility and clarity and maybe less decision makers perhaps than some of these larger organizations. At the same time though, right, smaller institutions that are large like mine but are municipal health systems, chronically, sort of dealing with margin issues, right, they might have the willingness, but sometimes finding resources can be challenging. And that's where, co-production, where startups, founders can sort of co-produce something with those systems can be really valuable.
Uh-huh. Is there much difference between, say, an innovation that is born of frustration and the solution tends to be fairly new and radical, as opposed to taking an existing technology like an EKG and modifying it so it can do more?
Yeah, it's interesting, right? I think sometimes the ones that get the most attention, right, are the ones that are the sort of, wow, we've never ever thought of this before.
Right?
Right. And yet at the same time, right, you think of common things like EKGs, right? The ability for, EKGs now at scale to be done better, quicker, more efficiently with better diagnosis makes a lot of sense, right?
Right.
So I would say that there are those fun, sexy, interesting to talk about solutions, and yet we cannot ignore the entire continuum of care because clearly there's a lot to be done.
Uh-huh. So how do you measure job satisfaction when it comes to the influence of change? Because not everybody's going to be completely honest with you, I would guess.
Yeah, well, so I think again, in that spirit of making the work for you, right? You can have focus groups with people, you can sort of look at the numbers of adoption, but there's one actually survey that every health system or every delivery organization that is accredited by the Joint Commission and a few other accreditors have to do every 2 years. And that's the Safety Culture Survey.
Okay.
So it's a series of questions that basically ask in an anonymous way healthcare workers about their perceptions of care delivery, right? Which is really, really powerful. And as part of that survey, people take this very seriously because it's a requirement to do so. And the kicker is, Jim, not shockingly, places that have better safety culture have better outcomes, right? Better outcomes, better reputation, more remuneration, all of those things. And so leaders will pay a lot of attention to this existing survey. And so I would encourage, people who are pitching to different health institutions to be able to try to tie it to safety culture. Because, the idea that, wow, this technology answers a challenge that we have been saying is a challenge
Right.
is a really big deal.
So it's empowering in a way.
That's right.
Yeah.
And you can see that measurable trend, every other year.
Yeah. Well, this is an industry where change is inevitable, especially now. And just
Sure
in the
is.
last couple of years, the number of things that are different and better, hopefully, and are improving patient outcomes. You'd think that in this short period of time, that alone would help change the culture.
That's right. I mean, you'd hope so, right? And I think that, to your point, I think a lot of people have known for a while that change was necessary. But I think as you look to, different agencies, different levers, everyone is talking about the need for change. And certainly that gives me, a lot of hope and delight, really, as someone who's like really interested in changing things.
So the opportunity to speak at HITLAB again, and talk to the group, and how valuable is that for your mission?
Yeah, absolutely. I mean, I think that, listen, as a physician who is young but not that young, right? I was not a digital native, right? I sort of came to it because I recognized the importance of technologies. And so I think, the variety of perspectives that you see here, right, really allow for, me to think differently when I go back and I'm thinking about implementation and, all of the sort of roadblocks that you sort of alluded to earlier.
Well, Komal, congratulations on forging forward. It's very necessary work, and I would think that the bosses in the ivory towers are pretty pleased with the results that you're getting.
Thanks, Jim.
Yeah, thanks.